instead of using toilet paper, which is dry, she can use the wipe. And I advise to use it probably from front to back to avoid contamination from the out area.
Right.
And again, she will need natural perfume, which is the deodorant. She need all this four to be in her hand on daily basis and to use more than once every day.
Toes and
So we try to kind of
all these tests.
I retired and obviously, but thankfully.
Hello and welcome to this special episode of Tell Me Why, the Gulf News podcast that brings you honest, engaging conversations about modern life, health and personal care. I'm your host Sophiya Anjam from Gulf News, and today I'm going to be talking about something that a lot of women can relate to, but unfortunately, they don't talk about it. It's very rare and it affects every woman, which is feminine, intimate hygiene. We often relate feminine hygiene to menstrual period care and ignore it during other days. We are here to explore why caring for the intimate area daily is just as important as face care or skin care, how small daily habits can boost confidence and comfort, and why it's time to break the myths and taboos around feminine hygiene. So joining me today is Dr. Fadia Alkhalil, the specialist in gynecology at Zahra Hospital Dubai. She brings years of experience in women's health and is a strong advocate for empowering women through accurate, stigma-free information. Dr. Fadia, welcome to the Gulf News podcast. How are you today?
Hi, and welcome in this special topic. It's hard to speak too much about this area, but today me and you we can help to break this taboos.
Absolutely. But with years of your experience, I'd like to plug in something for you. They say that medicine cures diseases, but doctors cure patients. That's especially for you, for the service in your communities. Thank you for that.
Yeah, thank you for touching this moment that we speak with the patient.
Yes.
To let the patient more confident to tell us what she feels. Because many issues, they are shy even to discuss with their doctor.
Absolutely.
It takes time.
Absolutely. From a medical perspective, I'd like to ask you this question. Why should feminine intimate hygiene be considered an essential part of a woman's daily self-care routine?
Yeah, why it should be daily? Because most of my women who come to the clinic, they take care about menstrual time, about postpartum time, but they forget other days.
Yeah.
We should take feminine wash as daily basis care self. Why? Because it's not same skin, it's not same face, not same hands.
Yeah.
We cannot use normal soap or normal shower gel for this intimate area. Why? Because many specific, criteria in this area make the taking care of it special, and it should be daily basis to prevent the disease to come. Let's start by first one. The skin of this area most able to have sweat or dryness in some ages.
Correct.
And both affect the skin area to have more, micro tears, which the female doesn't notice even, more able to have infection, and especially the sexual transmitted infection, which is all they scare from it. If we keep this area suitable from the moistural side, at least it will protect the tears and protect the infection later on.
Absolutely. I'm so glad that you're talking about this, because this is a very sensitive topic.
Yes. Sorry to say that. They are even shy to speak with their doctor, with their daughter, even with their husband or partner about this area. But it's sensitive area, and it's an area where if we protect, we prevent infertility at the end.
Yes.
We prevent chronic pelvic pain. For that, let's open this speech to give some advice for our female. Again, it's sensitive area, different from other part of skin. We should take care on daily basis, not on special time.
Absolutely. I love that. So, there are so many different misconceptions in the society also. So in your practice, what are the most common misconceptions you hear from patients when it comes to feminine hygiene?
Yeah. First of all, they thought the normal soap or body shower, it's enough.
Right.
Just to be clear, vaginal area and vulva, this intimate area, it has specific acidity pH between 3.8 to 4.5. I check many brands of soap. To be honest, I found most of them the pH 9 to 10.5, which is totally different. That means we change the acidity on this area. If we change the acidity which related to the Lacillus bacillus bacteria, to the normal flora, that means we give a chance for yeast infection or bacteria to come and grow, because the pH now, it's okay for her.
Yeah.
Let's say about body shower gel. Also, I check many types. It's between 9 to 10. Again, it's alkaline.
Right.
For that, if we change the pH, that means we kill our flora, which protect us from infection.
Absolutely.
The other part, this alkaline or the hard soup, it's again, I will say, it will dry our skin. Let's say about the out area. If the out area skin dry, same hands. What eczema? Eczema is just a dryness at the end.
Yes.
But if it's dry, that means small abrasion or small tear will happen.
Right.
It gives a chance to the bacteria to come from out to in. Especially this area, we should notice it's near to the urethra, to the urine, and near the anus.
Yes.
And both, they are contaminated. Nothing clear.
Absolutely.
For that, we should take daily and hourly take care about this area.
Noted. Many women assume that regular soap or body wash is good enough. This is something that you just spoke about also. What's the actual impact of using those products on the intimate areas, pH and health, like you just mentioned? If you could mention that in detail also.
Most of the soap is factory made. That means the ingredients inside it, it's not natural.
Right.
That means it will not matching our nature. Our nature, it's prevent many infections, especially the yeast infection.
Of course.
If we change this nature, it will be more able to have infection. I don't say that the soap or shower gel will make the infection, but it will make our body able to get the infection.
Right.
And other thing, the urethra in the women different from male. It's so short. That means any bacteria in the skin, it might pass to the bladder and to the ureter and to the kidney system and make UTI.
Right.
For that, we always face recurrent urine infection in the female. We need some material. pH almost should be matching with our vagina pH, as I said, acidity.
Right.
It should be factory, naturally, not from the material which is chemical or hard or change the moisture of the skin. For that, we should find some material have all this.
Right.
I tried one, Femfresh.
Oh, I love it.
Yeah.
Yes.
Yeah. To be honest, they have intimate wash. It gives little moisture with little perfume, mostly natural perfume, not alkaline area.
And just the right amount, the right kind of balance, right? Yeah.
I found this Femfresh products. First of all, they have many options with different sizes, because later on I will speak why the size is also important.
Because one size doesn't fit all, and we women love variety also.
And about the traveling part,
yes.
If we will travel, in the flight there is rules. You cannot take big size, you cannot take this, you cannot take this. They prepare, I saw one package special for traveling.
Yes.
Because again, when we will travel, we'll stay many hours in the flight, and it's public, small toilet, we know that. Whatever they will take care, whatever they will help us, we should help ourselves.
Correct.
Again, it's self-care. We should protect ourselves from the infection before it happen. Prevent infection, cheaper and more healthy than get the infection and go to the doctor and wait the time to meet the doctor. And to take that time, we need oral antibiotic with vaginal, with many products, and that time it will be chemical. Doctor will not give something to protect. He will give to treat. Treatment always hard and more serious than prevent. I found with this Femfresh wipe, because our female, they spend maybe 8 to 10 hours out of the home.
Of course.
How we know how they will take care about themselves.
Yes.
Toilet tissue, it's dry.
Right.
It's dry, this area. But the dryness for 10 hours, it's not so helpful. Maybe it's oppositely, negatively affect their health.
Absolutely.
For that, if we give them this wipe in their bag, they can use it after every time they go to the toilet. And we should teach them how to use it.
Yes.
Because I found in my practice, the way of cleaning itself not correct. They start to pull from back to the front side. Oppositely, we should teach our daughters to clean from in front to the back to protect this area from anus area.
And that is why awareness is so important, Dr. Fadia, and I love the way that you have described everything. But now I want to come to my favorite question, because when it comes to bad odor, when it comes to itching, and it's very common. Sweating,
especially
bad odor
here.
Specifically. So can maintaining good intimate hygiene help prevent all of that?
Yes. This intimate hygiene, as we should keep this area breathable.
Yes.
That means the sand we will put here as powder, as talc, it should be not chemical, it should be paraben free, it should be pH matching with odor, good odor, to make the lady more confident. Sure, this is something important. Do you believe if we go to the work and she feel irritation or itchiness, believe me, she will not be so effective in her work.
100%. I can relate to that. I think every woman can relate to that for sure.
Yes. Confident and comfortable.
Yes.
For that, we advise them to keep this product in their bag. In case it happen anything, let's say irritation or some rash in this area, she can go within minutes to clean this area, to put little bit deodorant, healthy deodorant. I'm not speaking about any brands. To keep this area less irritation, no itchiness, and she should use breathable and white cotton under garment to keep this area breathable.
Yes.
Especially in this, let's say, in our area, in UAE, humidity and sweat, whatever they do at morning, it's not enough to protect them all the
we take care of our hair when we talk about humidity here in the UAE also. So we can definitely do that when it comes to our intimate hygiene as well, especially when it's compact. Because you can put it in your purse, in your wallet, in your bag, and it's very easy to access as well, right?
To be honest, every female should have that. I know some female, they put sun protection every 2 hours.
Yes.
Why they
so
remember
true.
every 2 hours to put sun protection?
Or the spray.
Spray this, especially who work in the TV.
Yeah, so
it's
true.
behind them, believe me.
I know.
But that for, let's say, at least for aesthetic or cosmetic part. But this intimate area, not just for confident, also to prevent disease, to prevent pelvic chronic pain. Many cases I did laparoscope for nothing, because the woman has chronic pain in her pelvic area without obvious reason. We do ultrasound, we do vaginal exam, nothing. When we go through diagnostic laparoscope, we find it just old infection, make mild adhesion and give her all this pain.
Yes, negligence for sure. So here comes a very important and a very integral question. When you talk about poor intimate hygiene, can it have long-term effects on reproductive health or lead to more serious complications like you just mentioned?
That's what I say.
Yes.
Poor hygiene or use alkaline or dry chemical washing, it's again one important reason for micro tear, which the female will not notice, her partner will not notice. They do relation. Unfortunately, bacteria everywhere in this area.
Of course.
Not coming from the partner. I'm not saying like that.
Yes.
It's there, and it comes through these tears. Same when we are breastfeeding. What happened? Always mastitis, because the baby cut little bit the nipple and bacteria come, whatever we clean, always there is common bacteria come and did mastitis. Intimate area, if it's with the small tears, any bacteria come inside, and this, if it go through our cervix and the tube, it will go for pelvic infection. The most important reason for ectopic pregnancy and for infertility, it's adhesion, because of STD, which we call sexual transmitted infection, which will not come without tear. Whatever it is, if we are protected, it will not come. Many patients lose, unfortunately, their ability to fertile because of this, which is so harmful.
Even public toilets, the usage of public toilets, you have to be very careful.
Whatever, it's cleaned again and again. Here they are taking care. They clean too much, but you don't know the moment the bacteria will come from out, and not from out. Again, I will say, By the way, yeast infection not coming from out, it come from our bowel.
True.
When we take, let's say, antibiotic or our immunity disturbance, yeast just grow because our good bacteria in our bowel killed because of the antibiotic. And now, mashallah, all the female use antibiotic for many reasons.
Of course.
Especially for acne. They use antibiotic sometimes 3 months.
Yes.
That means no probiotic, no good bacteria in our bowel.
Yeah.
This gives the chance for candida or yeast infection to grow in our bowel. This gives a bloating. Most of the patients come just because of bloating. And when this yeast infection come more and more, it comes from the anus to the nearest area, which is vagina simply. And they start, you don't know, yeast infection. Many patients, they leave the work and they take permission 1 hour to come to my clinic because they cannot continue the duty. Why? Because it's irritated too much. They feel like odemated, like itchiness. They come just to take anything emergency.
I'm sure you must have had so many different cases also, and so many experiences and a lot of success stories, I would say.
Yes. I always tell them, I know. Doctor, just 1 vaginal tablet you will give me? I tell you, believe me, now you are feel this serious issue. It's not serious too much.
It is.
I will treat you. Simply take it. And the next day they say, no, much better now, but they should continue the treatment. Apart from this, I want to say why we as doctor advise the patient to use intimate care self daily.
Right.
Especially in the postpartum time.
Yeah.
When I did the childbirth, some patient we cut them. You know, episiotomy sometimes we need. Some patient I don't cut, but small tears happen.
Yeah.
I don't sew or I see, but it's not to bleed. No need to suture. Even I suture. In between the suture, there is a small space, small cutting.
Right.
If I don't give something, let's say it should be, as again I say, it should give little moisturization with same pH and no chemical to protect them, to protect my procedure, to make it success. I will advise them to use daily basis, taking care. Again, for my patient, I give Femfresh. I tell them, try it. You will feel your area more natural, and you protect my episiotomy from infection.
Of course.
Because now we don't give even antibiotics sometimes after cesarean, after laparoscope, but we want to avoid or to prevent the infection.
Correct. You know, I'm so glad that you talked about this, and I think that, you know, even initiatives such as the Gulf News podcast that we're hosting, Tell Me Why, bridges that gap. They talk about taboos in the society. But my question to you is that, Dr. Fadia, in today's day and age, in 2025, do people still shy away from talking about it? And if they do, how can we help?
Yes. You know why? Before, or our elder ladies, they think this area important just for marriage and for bringing babies, unfortunately.
Of course.
Later on, they start to change, but it takes time. Now we should tell them, this area, it's important health area.
Yes.
Not just related to the relation or to become pregnant or to deliver. It's not like that at all. It's area of 3 important systems: urinary system, gynae system, and bowel and rectal system. 3 important systems, do you believe, in a small area and next to each other. That means our female responsible to protect this area, to take care, to avoid problem for 3 big systems in our body. How we take care about mouth and teeth to avoid just tooth problem, or let's say throat problem or lung. This area also, it has big 3 systems. We should take care. How we can start? We should start from home.
Yes.
Moms, they think just taking care about their girl, to send them to the school, to send them to the university, to find one good groom for them. It's not like that. This important part, they should speak with their girls, and not when they got married. When they got, let's say, 8 years, 7 years, whenever we feel our daughter able to understand our important discussion seriously, not to be shy. And we should teach them that speak about this area, that doesn't mean you are in sexual life.
Of course.
This is something different. You should start to take care about yourself, apparent far from sexual life. This different part. I am not telling my daughter that means it's allowed for you to do relation. No, you should take care to protect your health. Relation is relation later on. That's different part. Now we start to speak about daughters and about elder, let's say teenager, about the vaccine against HPV.
Yes.
How will speak about HPV without speak about self-care daily basis? HPV is one virus. It might come, might not. But bacteria, and yes, it's available every day. For that, For that, I'm speaking about daily care. Don't believe that your shower or gel shower or soap or once daily, that's enough to protect this area. Unfortunately, we should take care every day, multiple times.
Absolutely. You know, Dr. Fadia, I'm so glad that you're shattering the glass ceilings. And what you've done is absolutely incredible. But here comes again a very pertinent question. So what ingredients should women look for, or I would say rather avoid, when it comes to choosing products for intimate care? Like you mentioned a few of them also, but as we mentioned, one size does not fit it all.
Yes.
So before we conclude this discussion, I would love to know more.
Yeah, we should avoid any intimate wash alkaline bases.
Yes.
As I said, pH should be between 3.8 to 4.5. Who has that? Welcome.
Yes.
It should be talc-free. You know, now talc, they start to speak about cancerinogens. For that, sure, we should avoid it. Paraben, it's chemical, hard, let's say, ingredient would affect this area.
Yeah.
Especially, I want to speak about the elder women.
Right.
Who doesn't move very well, you know, after
Our
70,
mothers
80.
and our grandmothers.
Yeah,
yes.
not me and you.
What are you talking about? You're just 25. I have no idea what she's talking
about
about.
that. Elder women, sometimes they have hip broken, you know, this we call kill fraction. They stay in the bed about months.
Yeah.
And the trauma and erosion start to be there.
Of course.
We can use something not chemical, even for this erosion. For that, when I saw Femfresh, again, that has like talc, like powder talc-free.
Yes.
Oh, amazing.
Yeah.
That's very helpful for this part. They should use something with good smell, but naturally as possible.
Yes.
That's so important. They should use something, like I say, breathable powder.
I think that's the key word you used.
Yes.
Breathable and as natural as possible.
As possible. To keep this area not to sweat and not to dry. It should be in between moisturizing and natural. If any product has most of this, let's say, criteria, we can use it safely. For that, as I said, I searched too much. It's not easy to find just one brand, have all this product to take care about the out area and matching all the ages, you know, hormone changes.
Of course.
We give to the teenager, we give to the adolescent and to the elder woman.
Yes, correct.
We give to the pregnant woman, to the breastfeeding women.
The menopause phase as well.
For that, we should find one product or by many, let's say, phases, like powder, like wash, like wipe. But to manage all this hormone change, it's hard to find. But actually, for me, I found Femfresh. I advise all my patients to take, and they tried, and it's success. And now they said, "Doctor, thank you. Now we understand, but we want to work more and more. Thank you for your helping to break this glass, to start to speak about this area medically. We are not speaking anything apart from medical, but we should take care."
Absolutely. I'd just like to plug in something over here. You know how women love to have drawing room discussions? They love to have a conversation over tea. And if it was somebody who was a friend, somebody who was over to have a cup of tea, we were having a conversation, it would have been a different deal altogether. But it's you, Dr. Fadia, with years of experience, who's talking about this. So thank you for making a difference. Thank you for creating awareness, and thank you for making us learn and unlearn so many things today. We really appreciate that.
Also, I would thank you too much to open this discussion. We will discuss more and more. As I said, long time of hide education, of shy time. Now we need many years or many speech to break this class.
Absolutely. But I don't want to let you go because this last question, I was like, I was thinking, I just want to ask her one last question before we let her go because you're learning so much over here. So, you have a lot of products, like, for example, you have all these intimate washes and deodorant sprays and powders and wipes, and people love using them. So, when you talk about Femfresh, just mention that one thing that is prevalent in their products that people should just go for.
It's naturally more than you think. It has pH exactly same normal pH. It's talc-free. For me, it's more than enough to use it. The wipe of it, alcohol-free. For that, it's matching all the age after puberty. That's more than enough to choose it.
Absolutely. Dr. Fadia, thank you so very much. It was such a pleasure. And I would like to say that once a woman stands up for herself, she stands up for all women. Thank you for everything that you've done.
Most welcome. Wish all our female healthy life with more confidence.
So thank you so very much, Dr. Fadia. Absolute pleasure. And to all of our listeners, remember that self-care does not stop at skincare. It is much deeper than that. And if you talk about intimate hygiene, it's just as important, and taking care of it can boost your comfort, your confidence, and overall well-being as well. If you'd like to learn more about building a healthy, balanced hygiene routine, you can explore trusted products like Femfresh, available in stores and online across the UAE. Thank you for watching. We await your feedback. Don't forget to subscribe to Tell Me Why on your favorite podcast platform, or visit gulfnews.com/podcast for more insightful episodes. For now, my name is Sophiya Anjam. Thank you for watching, and remember that you have to stay clean and look good. Take care.